Welcome to the course Acupuncture Myofascial Lines for the Hips, Pelvis, and Low Back. This presentation is delivered by myself, James Spears. This first page is the intro, and I just want to cover some key points that we'll be discussing through this class. And the first one reads, the anatomy of four for treating the hip. So whenever we're treating the hip or the groin and the pelvis, we always need to consider four primary areas. This includes the posterior region, or what we see here is the superficial back line, and this looks a lot like the urinary bladder meridian. The next picture shows the superficial front line that is very similar to the stomach meridian, and this includes the anterior region, and in particular we see that the quads, and specifically rectus femoris, is on this line. Now, I mention rectus femoris because it's an important muscle for hip flexion. So we'll also be discussing functional anatomy and how different muscles are involved in the different movements of the hip joint. The next image shows the lateral line, and it looks a lot like the gallbladder meridian. We can see that it includes the glutes and the IT band. Now, in TCM practices, they're really fond of using GB30 for treating hip pain because this is a common area where people will feel pain. However, by considering the four areas of the hip, it gives us a wider angle. And we'll discuss in the course the way that there's this relationship between the gallbladder meridian and the liver meridian, and how different muscle contractions can cause strains in the internal-external relationships that exist as we think of them traditionally, but also in biomechanics. So we'll be discussing things like internal and external rotation, how this relates to the meridians and the fascial lines, as well as how this relates to traditional points and Master Dong's points. The next image you see here is of the deep front line. And this is an important myofascial line to use whenever we're treating conditions of the groin. But some of the muscles that are on this deep front line are also involved in several different kinds of movement of the hip. Some of the muscles on this line, such as the psoas, are involved in hip flexion with the rectus femoris, and then the adductors on the medial portion of the thigh are involved in adduction and moving the leg towards the midline. So we'll be discussing the relationships between the different functional muscle groups and the way that this relates to hip flexion, hip extension, abduction, and adduction. Now, movement is necessary for getting good responses when treating the hips. So when doing acupuncture for hip pain, one method is to do local points into the areas where they feel pain. However, if they have pain in the groin that's resulting from problems in the lateral line, or they have pain in the gallbladder meridian, but also in the liver meridian, then we need to know how to treat these two areas simultaneously based on the root pattern and disorder. So when treating the hip, you'll often find that you get better results when you do non-local needling and then use prescriptive movement with the acupuncture points in. So we'll be discussing various group of points on the arms and on the hands that we can use for various kind of hips and pelvic conditions. And when we do the points in the hands and arms, then we can show the clients a series of movements that they can do to correct the underlying disturbance. The next point here reads, understand how to use arm and leg points and when they will and will not be effective. So through an understanding of functional anatomy and the way that this relates to traditional acupuncture point indications, we can start to better understand when points on the arms will work and when they won't work, as well as when the leg points will be effective or when they won't be effective. Functional anatomy will give us a better understanding of traditional point indications, both in the classical systems as well as in Master Dong's points. We'll also be discussing non-local or distal needling versus local or direct needling. So there are two primary ways that we can choose points. We can do non-local points, meaning that the points are distant from the affected or symptomatic area, or we can do local needling where we needle into the symptomatic region. Now, there are times for doing both methods, and even in the traditional systems, such as TCM, they'll often use both of them together. The method that I teach starts with distal needling, but then will move proximally or towards the area of symptomatic pain if needed. Oftentimes, non-local needling can be enough to stop the pain and to correct the condition, and local or direct needling can be used towards the end of treatment sessions or at the end of a course or series of treatments. There are advantages to beginning with non-local points, some of them being that you run less of a risk in aggravating the condition. There are certain conditions that you shouldn't do local needling with because you will make it worse. Another advantage of using distal needling is that it often works faster and provides quicker pain relief as well. So we'll be discussing this throughout the course. Another key point here reads, start with distal needling and move proximally or towards the area of pain. So I just discussed that, and there's a lot that we can say about that and the way that that relates to treating the hip. If you're trained in the classical systems of acupuncture, then it's very likely that you're doing both non-local and local needling, but probably using those together. So when we distinguish between non-local needling and local needling, it helps us also to have a better understanding of what points work best for what client, and it helps us to avoid adverse reactions. So it really helps us to clarify and refine what points work for each individual and what points don't work. And when we take this into the context of functional anatomy as well, then we'll have a better understanding of all of these concepts and the way that they relate together. One of the final comments here reads, create realistic expectations for outcomes for treatments. So treating the hip can be difficult, and I know a lot of acupuncturists struggle with it. I certainly did in my early career, and because it is a condition that is often difficult to treat and may involve chronic disorders such as osteoarthritis or sciatica or tears within the hip joints or within the connective tissues, it's really important that we have realistic expectations and that we tell our clients about that. So for a lot of chronic conditions, typically I'll recommend that the client start with a series of 4 treatments, because that gives me enough time and them enough time to fully assess what acupuncture can do for them. Okay, so I think oftentimes in acupuncture, and especially in the Master Dong system, we are well known for getting fast results, even for chronic and difficult to treat things. However, it's important for us as acupuncturists to have realistic expectations for our skills and communicate this to the client. So for many chronic conditions of the hip, it's beneficial to tell the client that they should have a series of 4 sessions to start, but that we anticipate getting relief and noticeable benefits as soon as the first treatment, and then we'll gradually progress through there. At the top of the page it reads, what meridians are affected, and Ton's 6 systems. So Dr. Richard Ton was a well-known acupuncturist who taught the balance method, and he taught Master Dong's points. And his method of using the 6 systems for acupuncture is a superior system to use because it relates to the various connections that exist between the meridians, such as the internal-external relationships, as well as to the relationships that exist between the Tai-Yang meridians, the Xiao-Yang meridians, the Yang-Ming meridians, the Jue-Yin meridians, etc. Now, there are some other systems in his method, and they'll be discussed in a separate section. A lot of this with Ton's systems is also based in anatomy as well. So it's really important to consider the functional anatomy of his systems. And we can see the way that that plays out when we compare that to a functional anatomical perspective using the myofascial lines, as well as fundamental and natural movements that occur within the hip joints. I've also written at the bottom of the page here that there's 3 categories of patients based on responsiveness. This is a very important thing to keep in mind, and something that has been identified by some of the medical researchers, and I believe Felix Mann was one of the first authors to comment on this. So essentially we can classify patients into 3 categories based on how they respond to acupuncture. We have sensitive responders. So these are people that respond very quickly, very easily, and are quite needle sensitive in a lot of cases as well. With sensitive responders, we can often just do 3 to 6 needles and get good results with them. And if they are hypersensitive, then we want to use fewer needles with them. Now, there's also the mid-range responders, and this is your typical person. So they'll respond to acupuncture, but they're not nearly as sensitive, and they don't respond as quick as the hyper-responsive group. Patients in this category will typically require an average number of sessions between 4 and 6 to get optimum results, but they will also start noticing improvement quite quickly. The final category are the slow responders, and slow responders, as the name implies, they don't respond very fast, if at all. They may not feel the needles. They're not needle sensitive typically. You can have needle sensitive clients who are non-responders though as well. So that's not always a clear-cut distinguishing factor between the sensitivity level and the way that they respond. Non-responders also tend to be overweight or have large body types. So keep in mind your client and their body type, as well as how they respond to the needles, their sensitivity, and how fast they get results. And that can all help you to determine a proper course of treatment for each client. So where a sensitive or hypersensitive person may respond very quickly and need as few as 2 or 3 sessions, a non-responder is more likely to need 6 or 8 or 10 sessions, whereas an average responder will often get very good results with anywhere from 3 to 6 sessions. So when you know how your client responds, then you can make better recommendations to them about how to design a course of treatment and what to expect. All right, let's take a look at the next page, and it's called the yin-yang of contraction and strain. Pain may be felt in areas of muscular contraction or strain. For any muscle that shortens, there are antagonists which lengthen, and chronic contractions and strains affect the opposing muscle groups. Understanding these dynamics will allow you to have more accurate diagnoses, reduce adverse needle reactions, and get you better clinical results. So often we think of pain being in areas where there's contraction. And I think this has something to do with trigger points and the way that they involve muscular contractions, and the way that people hold chronic contraction and the way in which that's often associated with areas of pain. However, we need to keep in mind that whenever a muscle contracts, there's a group of antagonists which will lengthen. And very often, people will feel pain more in the areas where there are strain. So if a muscle has become too long or is in a chronic lengthened position because the antagonists are in chronic contraction, then that region where there is chronic lengthening and strain produces weakness as well as pain. And this is a really important dynamic to keep in mind for the hip joint, because we see a lot of different cases where an area of contraction in the pelvis or around the hips will cause that chronic lengthening in another region, and that's where the client feels pain. They will very often feel pain in the area where the muscles have become lengthened and have become weak and are in strain. So you need to understand that if you're only treating the area of strain and not addressing chronic contractions, then that's going to produce less efficient results. Now, we can make the inverse statement of that as well. If you're only addressing the areas of chronic contraction and not treating the areas where there's strain, then that can also produce suboptimum results as well. The next point here is direct and local needling into contractions and strains vary according to the acute and chronic condition of it. So typically and generally speaking, for acute sprains and strains, we don't want to needle locally because that can aggravate the situation. And I think the most common and well-known example of this is in an ankle sprain. And we're taught this in school that we shouldn't needle locally into ankle sprains. Well, the same can be said for other types of sprains, and it's not uncommon that if a person has an acute sprain, such as in the lumbar area, that local needling can aggravate it. Now, we can say the same with acute contractions and muscle spasms as well. And I suggest that you don't needle locally for most acute conditions, and that it's best to start with a non-local system 1. So system 1 refers to the relationship between the meridians based on their traditional names, and this really has a lot to do with the anatomy of the meridians as well. So for instance, the Taiyang meridians include the posterior region of the arm and the small intestine meridian, as well as the posterior region of the leg, being the urinary bladder meridian. So, in Dr. Tan's system, we recognize that there is this relationship between the posterior lines of the arms and the posterior arms of the legs, and we call that the Tai-Yang connection. We also recognize a similar relationship between the anterior regions of the arms and legs, and we call that the Yang-Ming relationship. So that's the system 1. Now, in cases of chronic contractions and strains and trigger points, these will often respond well with local needling, but local needling may also aggravate some conditions, especially if it's a neuropathic condition and in cases of hypertonicity. Structural and postural changes are often necessary, and for chronic contractions and strains, we can use system 6. So in system 6, we're going to needle the same meridian where the person has pain. So if someone has pain in their glutes or in the area of GB30, we can needle locally into GB30, or if we needle down the IT band or down the gallbladder meridian on the thigh or the leg, we call that a system 6 connection or method, because we are needling into the meridian which is affected and has symptoms. Now, with chronic contractions and strains, They do respond to local needling, but as I've mentioned, sometimes you will aggravate by needling locally. So we're going to look at some of the reasons behind this and come to a better understanding of why local needling can aggravate conditions and when you should avoid it, as well as when you should do local needling. And in the case of the hips, for non-responders, they will frequently need local needling. I don't suggest starting there. I suggest starting with the distal points because you can move the affected region and show a series of movements to your clients so that they're moving their hip while they have needles in. But then if we don't get the desired result with those methods, then we can move on to local needling. And you will encounter cases, especially in non-responders, where local needling is necessary for treating the condition. The next point in red reads, chronic contraction and strengthening in one group of muscles can cause the antagonist to become weak and strained. So we've discussed this, but I just want to emphasize that because when you contract muscles, then it strengthens them. And this is what people that go to the gym do, is they focus on contracting the muscles using weights, and that helps to strengthen them. Now, if you only strengthen one muscle group and not the antagonists, then that will cause weakness. So for instance, if you only focus on strengthening the biceps, then the triceps will become weak. Now, something similar occurs in the hip joint because there are a variety of muscles that can go into chronic contraction. And when that happens, it's going to produce strain and weakness in the antagonists. So this is something that we're going to look at closely along with the functional anatomy of the hip. The second point here reads, discuss how this relates to various patterns and disorders of the hips and back. So we want to come to an understanding of how the chronic contractions and the strain relate to the various disorders that we see when we're treating the hips and lumbar region. And a primary treatment principle that I want to emphasize in this course and in treating the hips is that we want to ease the chronic contractions and strengthen where there is strain. So we can ease the chronic contractions by applying acupuncture. However, to strengthen the area which has become weak or strained, we frequently need to use prescriptive movement for that. So we'll be discussing some of these, and I'll show you some routines that I do for people with hip and lumbar pain as well. In this section, I want to talk about tensegrity. So if you've seen some of my other courses, then a lot of this will sound familiar to you. I've added a few new topics here that I want to discuss. So first of all, tensegrity, it includes two words. It includes tension and integrity, and it describes systems of compressed parts in a net of tension. So anatomically, we can think of the muscles as compressed parts, and they're surrounded in these nets of fascia. Tensegrity also describes how tension moves through a system, and like the meridians, the fascia are an interconnected system that connects the entire body, both internally and externally. Now, this topic about how tension moves through a system is a really important thing as acupuncturists to understand, because very often our clients come to see us for tension-related conditions. Now, tension is a pulling force. If we look at the physical mechanisms behind it, it's defined as a pulling force, and it can create strain. So another thing that we need to understand is in this image of the biceps and triceps, you'll see above it, it says chronic contraction and strain. So if we contract a muscle like the bicep, then it shortens, but the antagonist is the tricep, and it will lengthen. Now, if a muscle gets lengthened too much, or there's too much pulling force or tension on it, that can strain it and then cause damage. So We've talked about in the introductory section, we talked about contraction and strain already, and we're going to discuss it in several contexts in this course. And it's really important to understand this statement that you see above the picture, chronic contraction and strain. Because what we find in the hips and the lumbar area is that it's very common for certain muscle groups to go into chronic contraction, and then the antagonists can become strained. And often people feel the pain where there's strain. So when we come to understand where people hold chronic contraction and where the tension or the strain gets held and how that relates to their symptoms, then we're going to be much better prepared to find the most appropriate points, to release the chronic contractions, and to stop the pain where the strain is at. So this next part here reads, our job is to find where their tension is being held and how to best release it. How does tension move in each client? This is a very important thing to consider as well. And this relates to the acupuncture points and how to find the best points. And if we're just going with a textbook location, then we're really missing the mark a lot of the times, because tension is not going to be held in everyone in the same way. So understanding how to find tension in your clients and how it moves through the system is an essential part of what we do. And I find that thinking in terms of tensegrity is really beneficial to acupuncture and understanding how to create point prescriptions and how to pair your points up and how to transition through a single session or through a course of treatments so that you're not always using the same points, and so that you're changing your point prescriptions based on where the tension moves or what you know about the underlying chronic contractions that may be present and how that's producing strain. A common question I like to always ask myself in each treatment that relates to this is, what group of 3 to 6 needles will best release the tension from their system? I think that's a really important question to ask. And as you get better at locating how tension is held in each client, then you'll be better prepared to answer that question. Now, these next two statements you've probably heard before if you've seen some of my other classes. If you haven't, I'm going to read through them again because they bring up really important things that relate to tensegrity. The next statement reads, fascia connect the interior and exterior and play structural and functional roles. Now, that's a very important thing to consider as you study this course, as you study tensegrity, is the role of structure and function, because they're interrelated. And we'll take a look at this as we start to understand the functional anatomy and the way that that ultimately relates to the structure. So when I see my clients, I'm always asking myself, what's going on structurally in the hip or the lumbar region? And how can I best find those points that's going to produce a functional result? And there's a lot of more things that I could say about structure and function. I'm going to leave it at that for now because it's such an important concept. I'll leave you to contemplate the role of structure and function as you progress through this course. The next sentence reads, externally, junctions in the fascia often correspond to meeting points in meridian theory. Okay, so where we have these ideas of traditional meeting points between different meridians, we'll often find anatomical junctions. And this is something I explore a lot more in my 201 and 202 courses. So I'm not going to spend a lot of time on it now because some of you have probably already seen that. And we're just going to cover what's most relevant to the hips and the lumbar area in this course as it relates to structure and function and meeting points and these things. Internally, the fascial connections relate to internal, external meridian theories and Ton systems. Okay, so If we look at the internal anatomy of the fascia as it relates to the visceral fascia and the way that the visceral fascia connect to more external structures, then we can also see a lot of correlations between TON-6 systems, meridian theories, and the anatomy of fascia. The next point here reads, Dr. Helen Lange's research has shown that acupuncture stretches fascia when grasp and twirling occur. This is really interesting. Her work is really something to look at if you're into the physiological mechanisms of this. And one of the most significant things that she found that relates to this and relates to the mechanics of how acupuncture works through these myofascial lines has to do with the way that acupuncture can induce stretching through the fascia, and especially when you twirl the needle. And I know there's a lot of different needle techniques out there, and I've experimented with a lot of different techniques over 20 years. And what I've found, and what her research has found as well, is that when we just simply twirl them, then it's going to provide a gentle stretch through that fascia and assist in us getting better treatment results.